Hello, welcome to the online program for BLS training, that is Basic Life Support Training. I myself, Dr. Rajesh from the Emergency Department. I am the Senior Consultant in the Artemis Hospital. Now let's say why and how we do BLS. Why Artemis Hospital is taking so much effort to train people more and more, day by day, so that everybody knows about BLS. What is the importance of BLS? So I will take 2 minutes of you to make you understand what is BLS. So BLS stands for Basic Life Support. Who requires BLS? BLS is required by a person who is unconscious, unresponsive. Whenever you see a victim who is unconscious, unresponsive, if you are a BLS service provider, your action is immediately required to save his life. So now, during this 20 minutes or 25 minutes, I will give you a basic idea how to perform basic life support whenever it is required. It is not only in the hospital setup that everybody should know BLS. BLS is mandatory for each and every person. Every citizen should know BLS, because the more persons are aware about basic life support, they can save life anytime. Emergency can occur anytime, anywhere. In school, colleges, offices, any public gathering areas. Any person might require a basic life support. So now we will come directly how to perform basic life support. So what are the things that you require? Now basic life support, basically whenever you see a victim who is unconscious and unresponsive, your action is immediately required. So there are 4 chains. There are chain of survivals. It has been dedicated chain of survivals. Early access, early CPR, early defibrillation, and early advanced life support. So what we will do, whenever we see a victim who is unconscious, unresponsive, the first thing that we do is to reach to that victim, make the scene safe. For example, if the victim is in the middle of the road, you drag him, take him to a side of the road, not in the middle of the road, take him to the side of the road in a safe place. That is the scene safety. So you will have to ensure that the scene is safe to do a basic life support. For the scene is safe for the victim and for yourself also. Now, the first thing what we do is to check the responsiveness of the victim. How to check the responsiveness? Tap the shoulder, ask him, are you okay? Aap kaise ho? Any language you can use it. If the victim is unresponsive, it means he is a candidate for basic life support and you have to act fast. The first step in basic life support after checking the responsiveness of the victim is to call for help and ask for aid. That is the first thing you should do. What is AED? Now later in the video I will explain you that what is AED. AED is an automated external defibrillator. We will speak it about in the later. So the first thing we did, we asked for help, called for help and asked for AED. Now we return to the victim. What we should do after returning to the victim? We will check for pulse, whether the victim's heart is beating or not. For a layman, it is very hard to check the pulse. It will take time. So the time should be not more than 10 seconds. It should be in between 5 to 10 seconds. And feel the carotid pulse. Carotid pulse is in the neck, this area. So we take 2 fingers, check the carotid pulse for 5 to 10 seconds. If you don't feel the pulse, it means the victim's heart is not beating, or it is beating so poorly that it is not able to pump blood to the brain and the heart itself. The next action will be chest compression. When you feel that there is no pulse, immediately remove the clothes and start chest compression. Chest compression is done in the center of the chest, the lower 1/3 part of the sternum. The technique of doing chest compression is the main part of basic life support. How you do it. So start chest compression, that is 30 immediately. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 till 30. after 30 chest compression, what we do? That is the C. C stands for chest compression. After 30 chest compression, we open the airway. A. Open the airway. Head tilt, chin lift. Or jaw thrust. Head tilt, chin lift or jaw thrust. We open the airway. That stands A. Then we give 2 breaths. Maintaining the head tilt, chin lift position. So the airway is open and then we give 2 breaths by pinching the nose. If we don't pinch the nose and give air, the air we blow inside will come out of the nose. So that will be B. So C stands for chest compression, A for opening the airway and B for giving 2 breaths. So CAB, that is the cap. And we follow that CAB chain, 30 chest compression, 2 breath, 30 chest compression, 2 breath. That is the cycle of CPR. So 30 chest compression, 2 breath, 1 cycle of CPR. So we do 5 times. So after 5 cycles of CPR, that will take approximately 2 minutes, we reassess the victim. We check for pulse only after completing 5 cycles of CPR. 5 sets, 30 is to 2. 30 chest compression, 2 rescue breath. If there is no pulse, we continue doing CAB. 30 chest compression, 2 breath. 5 times more. Then after 2 minutes, we once again reassess the victim, check the pulse. Carotid pulse. Time not less than 5 seconds, not more than 10 seconds. If you are not able to feel the pulse, we will assume that there is no pulse. You start chest compression. Follow CAB. CAB. Now, the last chain that will come into play is break. Ask AED will arrive. So when it will arrive, if you have followed the first chain, that you have called for help or asked for AED, then you are waiting for the AED to arrive. Now once the AED is available, the person who has brought the AED will attach the pad. The AED has 2 pads. It is an automated external defibrillator machine. It means it provides shock to the victim. Some AED starts automatically, or some it has a red button, you will have to push the button. So the first thing we do, we switch on the AED. Why we first switch on the AED? Because AED is a machine that is not frequently used. So to minimize that whether the AED is immediately functioning or not, we first switch on the AED. AED contains 2 pads, and in the back of the pad it is mentioned which pad is to be attached in which place. One on the right side below the collarbone and one on the left side in the armpit. So the 2 pads are attached, and then AED will analyze the rhythm. Remember, the person who has brought the AED will attach the pad. Meantime, the person who is doing the chest compression should continue. There should be minimum interruption in doing chest compression. Because a good basic life support to save somebody's life, the chest compression is very, very important, and the interruption should be not more than 10 seconds at any point of time. So, the person who is doing the CPR, that is the chest compression, should continue doing chest compression, and the person who has brought the AED will attach the pad, and then when AED will prompt you that the machine is analyzing the rhythm of the victim, that time you will have to leave the victim. And only at that time, if somebody is doing chest compression, will change the place. Because the person who is doing chest compression might get tired, fatigue. So after, when the machine is analyzing the rhythm, AED is analyzing the rhythm, he will change his place. The other person will take over the chest compression. So after analyzing the rhythm, the AED will let you know whether the rhythm is shockable or not shockable. It means there are 2 types of rhythm. Some rhythms are shockable and some rhythms are not shockable. Now, If the rhythm is shockable, the AED will tell you to press the shock button. You press the shock button, shock will be delivered. Remember not to touch the victim at the time when you are pressing the shock button. Ensure that nobody is touching the victim, no oxygen is connected to the victim, and then you press the shock button. Shock will be delivered, the body will jerk a little bit. That will ensure that yes, shock is delivered to the victim. And then after the shock, immediately the AED will also prompt you, resume chest compression, resume CPR. So after that, immediately CPR is started with chest compression. So now you will follow CAB once again. Chest compression, airway, and then 2 breath. Just 30 chest compression, open the airway, and 2 breath. So 5 times. That is 1 cycle of CPR, 2 minutes. And only after 2 minutes, the AED will once again analyze the rhythm. So now you will follow the AED's instruction. AED will analyze rhythm only after 2 minutes. Only after 5 cycles of CPR. So after when the first time the AED analyzes rhythm, every 2 minutes the AED will prompt you that leave the victim, please don't touch the victim. The AED machine is analyzing the rhythm, and then it will prompt you whether the rhythm is shockable or not shockable. If shockable, the machine will tell you press the shock button and resume chest compression. If the rhythm is not shockable, after 2-3 cycles of CPR, if you hear that the rhythm is not shockable, what you will have to do? You will have to check the pulse, and then if the pulse is present, well and good, the victim heart has resumed its work. It is beating now, so you no need to do chest compression. Wait for the help to come and transport the victim to the hospital. The medical team will take over the victim. But if the rhythm is not shockable, and if you don't find a pulse, you should start chest compression. Rhythm is not shockable, pulse is absent, only thing you can do is to provide chest compression. So 30 chest compression, open the airway, 2 rescue breath, and continue it for 5 cycles of CPR. And only after 2 minutes, once again you analyze the rhythm. And in this fashion, you continue doing chest compression, airway, breathing, CAB, CAB, till the time as long as you get a pulse of the victim, or the victim is transported by a medical team to a hospital setup, or in their critical care ambulances, and they will take the victim to the nearest hospital. So in this way, we continue doing CPR, that is basic life support. Now 2-3 questions will be arising in your mind. What happens to the victim who requires basic life support? Let me answer it. A victim, mostly 87%, is due to a bad rhythm. The abnormal rhythm of the heart, that is the culprit that makes victim sudden unconscious, sudden cardiac arrest, followed by respiratory arrest. So its heart stops working. So the victim requires chest compression. What we do with the AED? What we can do? The question will be there, whether first to give shock or first to do chest compression. So we always have hand with us. So we can always be able to give first chest compression, then only the AED will arrive, and then we can check the rhythm, and if the rhythm is shockable, we shock the victim. What we try to achieve when we shock the victim? Do we try to restart the heart? Or do we try to stop the heart? What we try to do? As I told you all, that basic life support is not only for medics, not only for doctors, paramedics, nurses. It is for everybody. Any person who is aware of basic life support can do, because we don't use any medication here. This is only a technique. We do out hand and mouth. With hand we do chest compression, with mouth we give 2 rescue breath. 2 rescue breath after every 30 chest compression. We can use a barrier. Self-protection is also important there. Personal protection. You ensure that scene is safe. So by giving shock, what we do, generally when there is an abnormal condition, there is a shockable rhythm, that rhythm, it means that the heart is not functioning properly. The outcome is not good. The function of the heart is to pump blood, but it is not pumping the blood properly. So the vital organs, the important organs, brain, heart itself are getting damaged. There are lack of blood, so lack of oxygen is transported there. It means the tissues are getting thirst of oxygen. So what we are trying to do, we are trying to give chest compression by using the oxygen that is present, that is dissolved in the blood. And by giving the shock, what we are trying to stun the heart. We are trying to stop the heart completely, so that the part which is responsible for controlling the pumping capacity of the heart takes over the work, and the heart restarts itself and pumps properly. That's why AED is very, very important device. So let us reassess the thing. So the basic life support, BLS, what we try to achieve, we try to provide oxygen to the brain and the heart itself. The victim whose heart has stopped, the heart is not able to pump blood, it means it is not able to deliver oxygen to the brain and the heart itself, we do basic life support, that is CAB. Chest compression 30. A, airway, head tilt, chin lift or jaw thrust, opening the airway. B stands for breath, 2 breath after every 30 chest compression. That is 1 cycle of CPR. So we do 5 cycles of CPR and then reassess the victim and then continue doing 5 cycles of CPR. So the set of 5 cycles of CPR, that will take at least 2 minutes. Now what should be the depth of the chest compression? The depth would be at least 2 inches in adult. The rate should be at least 100 in 1 minute. So these are the things that you should be doing when you have a practice in the mannequin. Then you will be able to perform the basic life support. So now, I think now you are aware that who requires BLS, when to do BLS, how to perform BLS. I think I am able to explain you all and give you a basic idea that what is BLS and how or what it stands for and who can. So in the previous video you saw that was an adult basic life support. Now we will be discussing a little bit few differences between the adult, children and infant. So infant 0 to 1 year we take as an infant, 1 to 14, 16 we take children. So what are the differences? As you know, we do 30 chest compression and 2 rescue breath. So if there is a single person who is doing basic life support, it means 1 rescuer, single person who is doing basic life support, the ratio remains same always, 30 is to 2, 30 chest compression, 2 rescue breath. But if there are 2 rescuers, 2 persons who are doing BLS, so in infant and children we do 15 chest compression and 2 rescue breath, 15 chest compression and 2 rescue breath. The ratio changes. Now the depth, in adult it was at least 2 inches, in children it is up to 2 inches, and in infant it is up to 1.5 inches. Now in adult we were checking carotid pulse, in infant we check brachial pulse. Here you can find the pulse in this place. One major difference also is there, that when you witness an arrest, but if you are able to see that yes, somebody is collapsing in front of you, it means you have witnessed the arrest. In that scenario, you always follow the chain of survival, the sequence in the same way. First, call for help, ask for AED, then return to the victim, check the pulse and start CAB, that is chest compression, airway, breathing. But in case of children, if you don't witness the arrest, then there is a slight change. If in children and infant we don't witness the arrest, it means when we came, we saw that the victim is arrested, not in front of me. It means I don't know when he or she has arrested. It means then we will have to do first 5 cycles of CPR. That means we will check the pulse, no pulse, we do 30 chest compression, 2 breath, 30 chest compression, 2 breath, 5 times, that is 5 cycles of CPR. Then we follow the chain of survival. That is, we call for help, ask for AED, return to the victim and do chest compression, airway, breathing and wait for the help to come, wait for the AED to arrive. In adult, we used to do chest compression with 2 hands, with elbow straight, the other hand on the top, and we are above the victim 90 degree and doing chest compression. In infant, this chest compression we do with 2 fingers straight on the center of the chest where it is located, lower one thumb, 2 finger. In children, we use 1 hand, the heel of 1 hand. The motive is to give chest compression and reach the desired depth. So infant, 2 finger or thumb in circle. If there are 2 rescuer, this is one of the way that we can do chest compression like this in infant. In children, we use 1 hand, and in adult, we use 2 hands. So I think it was informative for you all. For details and everything, we will be having a training session in the Artemis auditorium where you can practice this and then carry on with the basic life support. Carry on with the basic life support service provided. Thank you.